Okay, so you have the view of the right hand, the interior view of the right hand. So that would be this one. So this is the one I'm going to work with here. Now I actually gave you a phrase to use, and let me just show you how that phrase works. Your carpals, which are right here, these are your wrist bones. And then you have your radius and your ulna. You have your metacarpals here, and then you have your phalanges down here, so your fingers. Carpals are probably the hardest things, the hardest bones that you're going to have to remember. But I'm gonna show you how this little mnemonic phrase works. And the phrase goes, so long, top part, here comes the thumb. So you actually always start at the scaphoid, which right here, this is the scaphoid. And you're going to start at the top part, and you're going to go so long, top part, my pen just stopped working, part, here comes the thumb. So this is the direction of that saying. Now this here is actually two bones, so I'm going to actually draw a line to kind of separate these two bones out. So goes along with the scaphoid, long, the lunate, top, goes with the triquetrum, part is the pisiform, here is hamate, comes is capitate, the is the trapezoid, thumb is the trapezium. So the hardest part about this saying is that you actually have 3 T words that you have to remember. So if you want to come up with a creative way to remember that, that'd be great. So I'm going to go ahead and switch to the highlighter and just make sure that you have all of these labeled. The radius, the ulna, the lunate, the hamate, the triquetrum, the pisiform, the scaphoid, the capitate, trapezoid, trapezium, carpals, which are your wrist bones, metacarpals, which are basically the bones in the middle of your hand, and then the phalanges, which are your fingers. Now your fingers, your phalanges, with the exception of the thumb, you only have 2 of these. So you got your proximal, your middle, and your distal phalanx, or phalanx. I don't care how you pronounce it, just as long as you know it, okay? So that's the hand. And now we are moving on to the coxal bone, I think. Yes, there it is. I like how they use the different colors to separate out the different parts of the coxal bone. Guys, this is just basically your hip bone. But we need to know that this is our coxal bone. Alright. And you didn't have a lot to label on this. You had 5 things, it looks like. So you should have labeled your ilium and your ischium and your pubis. And remember the pubis, this is the part that's going to join up with the other coxal bone. Right there, there's a piece of cartilage called the symphysis pubis. And so this is the part that's going to be closest to the pubic region. You also needed to label the acetabulum or acetabulum, and this is where the femur bone fits in. This is like a big old socket for the femur. And that's it. You don't need any of this other stuff labeled, okay? Just know that this is the coxal bone and know those other parts. The next bone that we have is the femur. Now, sometimes the kiddos get all confused with the femur and the humerus. I'm not really sure why, because the femur has this big, well, for one, it's big. It's a lot larger than the humerus. You've got this huge head and neck region here. You've got these big honking condyles in the back, okay? But people get confused. So, you should have labeled the head, which this is what fits into that big socket on your coxal bone. You should have labeled the neck, the greater trochanter or trochanter, and then you've got the lesser trochanter or trochanter. We also should have labeled the lateral epicondyle and the medial epicondyles, the medial condyles, the lateral condyles. And I think that you also, yes, were required to label the patellar surface. So let's talk about some of these things. Switch back over to my pen. All right, now, when people break their hip, it's usually not the coxal bone that they break. They actually break off this part of the bone. That was Mr. Maple that just knocked on the window. So, this just literally breaks off. And so, during a hip replacement surgery, they will replace this ball. And it'll be replaced with a metal ball. So they'll take a metal ball that usually has like this stake, and they stake it down into the femur. I know, ow, right? But that's how they do hip surgery. And a lot of times, the person will just be walking along, and it just breaks, and then they fall. It's not necessarily the fall that breaks the hip, which is kind of crazy to think about. The patellar surface, your patella, which is your kneecap, all right, it rests right there. What else do I want to say about the femur? Just remember, again, that this is the medial side of the bone because we look at the neck and the head. The head is actually going to, it's going to fit into the body on this side. So that's going to help you remember that this has to be the medial side of the bone. The medial epicondyle is here. The medial condyle is here because it's going to be on the same side as that head. Okay, moving on. Next thing we're going to be looking at is the tibia and the fibula. Well, the fibula is the lateral bone. The tibia is the medial bone. All right, and a lot of you, you can feel this shin. You have a really sharp shin. I have a super sharp shin. If you take your hand and you grab your bottom of your leg, you can feel your tibia, the shin. You can probably also feel this tibial tuberosity, which you should have labeled, the bump there. It's a big bump, kind of like in your knee area. But you can't really feel your fibula. But your malleolus, if you grab your ankle, those bones that stick out, those are your malleoluses. I think that's how you would say that. But your lateral malleolus is going to be on the outside or lateral side, and your medial malleolus is going to be on the inside of your leg or the medial side of your leg. You should have also labeled on these the head of the fibula, which makes sense because it's at the top, and the medial condyle, which makes sense because the body is going to be over here because this is the medial bone, and your lateral condyle is going to be on the opposite side, farthest away from the midline of the body. And then we've got the malleolus is labeled. So that's it for these two bones. So we're going to move on. Now we're looking at your foot. So again, think about where is your medial side. Well, this is your big toe. So this is the medial side of your foot. This is the inside. And this would be your lateral side of your foot. Okay? So, looking at the foot, we have our toes or our phalanges. Okay? should have also labeled your proximal phalanx, middle phalanx, distal phalanx, or phalanx. And then we have our metatarsals. This is basically like, the middle part of our foot. These are our toes. And then you have your tarsals, which are kind of, if you want to think of them as your ankle bones, I guess you could do that. This is your heel bone, your calcaneus. Kind of sitting on top of your heel bone is your talus. Right in front of the talus is the navicular. Some people say, well, that kind of reminds me of a Navy hat. I don't know about that. Then you have your cuboid, okay, which is over here. It kind of looks like a cube, I guess. And then you have your cuneiforms, all right? Now, I think these are easy because this is the medial side of your foot, so that's the medial cuneiform. And there are 3. So this one has to be the lateral cuneiform. And intermediate means in the middle. So that's the intermediate cuneiform. So I don't know. I just think those are pretty easy to remember because of that reason right there. You've got your medial. Oh, that didn't. Sorry. Didn't switch over to my pen. Your medial cuneiform, the lateral, and then you've got your intermediate. Now, some people come up with a phrase to remember these, kind of like the carpals in your hand. If that's going to help you, do it. All right? Do anything, everything that you need to do to remember this stuff. All right, so that's the end of the labeling of the bones, but I also have some other things that I want you to see. No. We're going to keep going here. Are you still with me? Oh, this is just another view of your foot. You didn't actually have to label this, but you can see how the talus rests right here on top of your calcaneus. This is your heel. And you can see how the tibia rests on top of it. So I'm just going to move on.